Hello, I'm Dr. Jeff Baer, University of Wisconsin-Madison. Today we're going to demonstrate a medial meniscus repair using the CONMED AIM meniscal repair device. So we have a right knee here, so we're going to go ahead and mark, and trying to make our portal positions, we want to mark the inferior pole of the patella here. We do have our medial pole here, lateral pole of the patella is right there. If we're feeling down, tibiotubercle down here, so our patellar tendons will be running approximately here and here. So I'd like to have a high lateral portal. It gives us better visualization. So I want to be right off the edge of the tendon, sort of feeling into the notch region. I'm going to come up. So we're looking at the medial compartment. Here we can see this medial meniscus, and the meniscus is actually in decent shape. Just because of the tightness here, we're going to do a little bit of a pie crust here to get this medial compartment opened up. Doing the pie crusting for an MCL to do a meniscus repair is actually pretty beneficial, and I would say probably in 75–80% of my meniscus repairs I'm doing a pie crusting now just to make access better, putting the patients in a brace afterwards anyways, and so the pie crusting just provides you better access. And if we look here, we can see this is our tear in the meniscus. So we have a vertical tear. This one I'd probably say is either a red-red or a red-white zone tear, so it's one that we'd anticipate to want to heal, and we can see we have pretty good meniscus here. So we're going to use the 25-degree CONMED AIM all-inside meniscal repair device. The device has the protective sleeve on it, so we can insert it into the knee without having a sled, which makes that a lot easier and makes this a one-step phase. And you can see how the protective sleeve protects your cartilage as you're putting that in there. So we have the sleeve pulled back there, and now we have our 25-degree curve here. We're going to go and place our anchor at the top of the meniscus first. This makes it easier for deployment and for tensioning of the repair. Quick push on the button to deploy the anchor. We'll back it up, come out of the meniscus, come straight down below it, giving us that vertical mattress, which is the strongest repair we can get is with a vertical mattress. And we'll go ahead and deploy the second. And as we back that out of the meniscus, we have our device deployed. We do have the blunt tip on it, so this allows us to tension the meniscus to repair it. We can pull on it, tension that suture back. Again, pulling that through, we got a nice vertical suture in that. And this is a nice, easy cutting device to use. It has a blunt tip on it, so it actually goes in really easily for getting to that meniscus. It prevents you from causing cartilage damage to it. And push that down, we can see the tip of that right there allows it, and just a little squeeze, and you have cutting it. So that provides a nice repair to that. So we got our posterior suture in place there, repairing it. Now we're going to switch our portals as we work our way a little bit more anterior. So again, we can see the sleeve, how well it really protects this here. And we just pull our sleeve back. We can set it also to set our depth. So we can set a depth limiter on that as well. And here we're going to go again. We're going to place suture over the top of the meniscus first. And we can see this really go in nicely. Deploy our anchor. Then we're going to come back and we're just come down below. Again, we're going to do a vertical mattress here. Deploy it back. Do our blunt tip. And we're going to go ahead and tension this. And we can see the sutures pull through that really nicely. And really pull that down. And now we'll just sort of slide out. And again, you can see that blunt tip really insert nicely there. And we're going to work our way to the front here one more time. This one we'll go ahead and place it in a horizontal mattress repair, just to sort of demonstrate all. Again, we have the nice, to bring our tip in there, so we'll come in. And here we're going to go oblique vertical. So we'll come through our meniscus there. And back it up a little bit further. There we go. So it's an active deployment. Actually, it provides some protection on it, because if you don't like where you put it, you can reposition it. That tensioned it really nicely. If you really end up in the front a long ways, you can always establish an accessory portal to get you just a little bit more of the angle across the front of the knee. Where are we at? There we go. I think we'll be able to get this here, coming through this position. So, reposition. A little bit oblique. A little more up in the front. We're really high up in the front here, so this is one that we'd probably establish an accessory portal for, just to get a little bit better purchase with. And then we control that tension on it. When we look down at our repair here, so there's our meniscus tear that we created. We have 4 sutures across. We have vertical mattress in the back there and there, an oblique one, and then we have a little bit more of a horizontal mattress here in the front. And you can really see it. We got a nice repair of the meniscus from it before. It's now stable to probing. Even in this old meniscus that doesn't have the best quality, and we have a nice meniscus repair here. Using both the 25 degrees of the reverse curve, CONMED AIM, all inside meniscal repair devices, that gave us an excellent meniscus repair like this.